Hi, everyone. Now, one of the questions I get asked fairly often is how do we differentiate between all the different herbs that we have for the liver? So I think as I've already been talking about for some time, I think we need to take a functional approach. And one of the key aspects of taking a functional approach to liver herbs is an understanding of the action. So let me briefly go through them with you. So firstly, we have the choleretic action, and now that stimulates the hepatocytes to produce more bile. Then we have, related to that, the cholagogue action. Now that's not actually an action on the liver, it's an action on the gallbladder. And what it does is it stimulates the bile release from the gallbladder. But you would expect in a situation where you want to enhance digestion, and especially the digestion of fats, that cholagogue and choleretic herbs go together. Then we have the terms hepatoprotective and hepatorestorative. And generally, the same herbs do both, but not necessarily. So obviously, hepatoprotectives will protect the liver from damage, and the hepatorestoratives or hepatic trophorestoratives will help the liver repair from that damage. So the big one there, of course, is St. Mary's thistle, or otherwise known as milk thistle. It's both hepatoprotective and hepatic trophorestorative, whereas a herb like Schisandra I see more as just hepatoprotective. And then finally, we have something related to a completely different function of hepatocytes, and that is their role in phase 1, phase 2 detoxification. So we don't have a simple term for that. Some people say liver detoxifiers, but that can be misconstrued, because if it's a liver detoxifier, the implication there is it's detoxifying the liver, and that's part of what they do, but it's not the full picture. What they're actually doing is they're stimulating the detoxification function of the liver. So often in various scenarios, you want to combine these herbs with these actions to get the best effect. And a lot of people misunderstand milk thistle, St. Mary's thistle, because, you know, there's some test tube research that shows that it might increase certain detoxification enzymes, but that does not translate through to clinical effects. And I have that quite well discussed in the St. Mary's thistle monograph in Principles of Practice of Phytotherapy. So the role then of milk thistle or St. Mary's thistle when you want to enhance hepatic detoxification is not to stimulate the detoxification itself, but to support the liver. Because one of the fundamental principles of functional herbal therapy is support the liver. And in a sense, it's, if you want the machinery to work and do its job, then the machine must be functionally optimally. And that's where the St. Mary's thistle or milk thistle comes into play. It doesn't stimulate detoxification, but it supports the machinery that does that task. Similarly, choleretic herbs, you want to stimulate bile flow from the liver. Well, if someone has a damaged liver or poorly functioning liver, you know, you don't want to be, you know, revving up your engine when it's a piston short, do you? Because you probably do more damage. So same thing, and that is that we put in the St. Mary's thistle, the milk thistle, to support the machinery, as well as the cholagogue choleretic herbs. I mean, St. Mary's thistle does have choleretic activity as well. So what are my favorite choleretic herbs? The ones that stimulate bile flow from the liver? Well, that's dandelion root, St. Mary's thistle, milk thistle. But the one that's most clinically proven, and I pretty well always use in that context, is the globe artichoke. And then some lesser known ones that are favorites, like, for example, the fringe tree. Now, it's quite interesting because sometimes I get patients come in and they have symptomatic gallstones. And they don't necessarily want surgery right away, but they want relief from their symptoms. And I've found those 4 herbs, for example, together with some herbs that would relax spasm, like chamomile and spasm in the digestive tract, that is, like chamomile and corydalis. The formula put together, taken at high doses initially, together with a good, perhaps low-fat diet, it takes those gallbladder symptoms away. And as long as the gallbladder is not completely blocked up with stones, it's quite safe for them to go on that way. And I've had actually some patients who've been able to delay surgery for literally decades, and they don't necessarily need to take the herbs all the time. It's just every now and then to settle things down. So that's the power of your choleretic herbs. Now, when someone's having difficulty digesting fats, they may be getting some malabsorption, and that can certainly be tied in with small intestinal bacterial overgrowth and other such issues. Then you want to also include the cholagogue herbs. So peppermint is a wonderful cholagogue, so I often use it in that context. But also you can rely there on a little bit of overlap with something like dandelion root. Greater celandine is a wonderful cholagogue, but you do have to be careful because cases have been linked to this rare idiosyncratic liver damage, but it's quite a good cholagogue. So I've already spoken about the key hepatic trophorestorative herb, which is St. Mary's thistle, milk thistle. There's probably not that many others that would fall into that category, so I mainly use it in that way. And for example, I have a patient with cirrhosis, and so when you've got a situation like that, cirrhosis of the liver, you need a fairly high dose of the milk thistle. So she's taking, for the product I use, 6 tablets a day, and she's getting wonderful results, and her markers and evaluation of her liver, it has actually improved. So that's how you use the hepatic trophorestoratives where there's liver damage. And the hepatic hepatoprotectants, they have a role, of course, when there's a lot of toxins in the body or high load on the liver or something toxic threatening the liver. Again, the milk thistle, but Schisandra is good in that context. And then we come to, well, what stimulates the detoxification capacity of the liver? Now, that's a 3-step process, this detoxification function. Phase 1, where you make the reactant or the toxin more reactive to get it to react to something. Phase 2, when you neutralize that reactive intermediate so it can be readily excreted via bile, particularly in urine. And then phase 3, which is getting it out of the cell, the hepatocyte, but also on a macro scale, getting it out of the body. So here's where the choleretics come in, because they don't stimulate phase 1, phase 2, but they stimulate phase 3. And then for stimulating phase 1, well, you have to be careful there because you make often a potentially more toxic intermediate from phase 1. So you don't want to be stimulating phase 1 on its own, and you want to be doing it gently. Mainly what you want to stimulate is phase 2. And fortunately, most of our herbs, they do work on phase 2. So phase 1, the main herb I rely that's safe and it's also hepatoprotective is Schisandra. And then or your phase 2 stimulants are multiple, because any herb that has activity on the NRF2 ARE pathway will stimulate phase 2. So key herbs that I like in that regard are rosemary and turmeric, and combined with Schisandra, but other NRF2 ARE herbs like garlic and green tea can also play a role there.